Hi, my name is Wendy. As a patient at Redcliffe Hospital, I would like to share why I feel it is imperative that any clinical handover is handled with empathy and compassion. The clinical handover can be a very anxious time for a patient, wondering what's going on. Do they know anything about me or my situation? Please involve me, the patient. Don't just treat me as a number on a chart. I'm a real person feeling vulnerable and possibly emotional. Talk to me, not at me or about me to others. Be courteous, introduce yourself and call me by name. I am an important part of the handover. Being actively involved reduces my anxiety. I then know what is happening and what to expect. It builds trust and confidence that my story and my condition is understood and subsequent treatment is being planned. I feel safe when I know what is happening. Ask me if I have any questions or if I have anything to add. Finally, if I am unable to comprehend what you are telling me, please speak to my carer or close family member. My recommendation for clinical staff is to remember that safe, compassionate care is about effective communication with patient and with other clinical staff members.
Hi, my name is Joel and I chair the Clinical Handover Subcommittee at Redcliffe Hospital. The purpose of this video is to provide you with an introduction to clinical handover at Redcliffe Hospital. Clinical handover is about effective communication between teams and within teams to transfer responsibility for all or part of a patient's care. Clinical handover is carried out in many forms across the hospital, every hour and every day of the week. You will hear more about particular types of clinical handover in this video. Clinical handover requires a standardised and structured process to ensure effective communication. At Redcliffe Hospital, the agreed communication tool to structure clinical handover is SBAR. In a recent staff survey, almost all clinical staff knew the clinical tool was used at Redcliffe Hospital was SBAR. However, 1/3 of clinical staff said they had not received any specific education on clinical handover. This video is designed to help fill this gap. Redcliffe Hospital has developed local procedures and work unit instructions that provide guidance to medical, nursing and allied health staff on the expected process for clinical handover. Please watch this video and read the Redcliffe Hospital Clinical Handover Procedure to familiarise yourself with clinical handover practices at this hospital.
Hello, my name is Renee and I'm a clinical nurse here at Redcliffe Hospital. I would like to briefly explain how we use SBAR as part of nursing clinical handover at Redcliffe. Nursing clinical handover ensures that the necessary information and responsibility of care for patients is transferred from the outgoing nurse to the incoming nurse at the end of every shift. Nursing shift-to-shift handover provides a mechanism to involve the patient in clinical handover to improve the accuracy of the information and promote a patient-centred approach to care. Except in situations where it is not appropriate, such as when the patient is asleep, nursing shift-to-shift handover occurs at the patient's bedside and includes a safety scan and review of the patient chart. The SBAR communication tool provides a guide for the communication of key information, including specific recommendations for safe patient care. The nursing clinical handover procedure summarises the recommended information that should be communicated as part of bedside handover. This information, called the minimum data set, may vary at a work unit level depending on the type of patient being cared for. However, SBAR provides an overall framework to ensure that key aspects are covered. The Redcliffe Hospital Nursing Clinical Handover Procedure provides the expected standard and process for shift-to-shift handover. If you are a nurse at Redcliffe Hospital, make sure to familiarise yourself with the Nursing Clinical Handover Procedure and any work instructions particular to your unit. For easy reference, keep an SBAR lanyard card with your staff ID. At the end of this video, there is also a link to a training video with examples of an effective and not so effective bedside clinical handover.
My name is Sandra and I'm an occupational therapist at Redcliffe Hospital. I would like to tell you how SBAR is used as a written clinical handover tool. In the occupational therapy department, as in other allied health departments, we do not have continuous overlapping shifts. However, we still need to provide clinical handover within our team from one day to the next. An important way we do this is to ensure our assessment and treatment plan is documented in the patient record and by providing a verbal or written handover. If it is not possible to provide a verbal handover, SBAR can be used to provide a structured summary for written clinical handover. SBAR can be used as a tool to structure information in other forms of written communication, such as email and reports. I recommend using SBAR to structure information when providing a written handover. For discharge documentation, follow the minimum datasets specified in the discharge summary or form. Use SBAR as a way to structure your communication.
My name is Eric, and I'm one of the staff specialists here in the emergency department at Redcliffe Hospital. I would like the opportunity to talk to you about how we use SBAR when communicating amongst ourselves here in the emergency department and with other medical teams within the hospital environment. Clinical handover occurs at every shift change here in the emergency department. As a medical team, we review the status of all patients in the department and ensure that any pending tasks are handed over to the next oncoming team. Another type of handover that frequently occurs here in the emergency department is clinical handover to other medical teams within the hospital. When a patient in the department is identified as requiring inpatient review or assessment, we phone the relevant inpatient medical team and complete the clinical handover by telephone, which is then documented in the Emergency Department Information System, also known as EDIS. SBAR provides an important communication tool to ensure clinical handover is both succinct and relevant. As medical staff, we need to introduce ourselves and state the immediate problem, provide only what's relevant to the current problem, communicate our assessment of the situation, and be clear about our suggested action or request. As preparation for clinical handover and during clinical handover, use SBAR to structure the key information that you provide. Clinical handover is part of two-way communication, so read back the information you receive, particularly if you are the recipient of clinical handover via telephone. At the end of this video are links to 2 clinical handover training videos, which provide guidance on how to provide effective clinical handover over the phone or when discussing a patient within your own clinical team.